And this topic of mental well-being to me is one of the most important non-talked about topics in medicine that
Yeah.
needs to be talked about.
Yeah.
And I've been telling everybody that. And what I found for me was that in my recoveries for the major challenges that I've had in my health, that there was very little talk about the mental impact that will have on you and the changes it has on you. And surviving major surgeries or recovery, not being able to do the things you want to do. The cancer journey was obviously the biggest. And I tell people all the time that my physical recovery was much easier than my mental and emotional recovery, which I'm still going through 2.5 years later. And I wish that somebody had talked to me about this on the surgical team before we even went into it. I sort of backed into it and started asking questions, and I got referred to this person, to that person, that person. Eventually found somebody who could help me. And it seems to be pretty common in the men that I talk to as well, who say, yeah, I'm having a really hard time adjusting, not just physically, but mentally, and not necessarily because of the medicines, because I've not had radiation and I've not been on some of those really strong cancer medicines, but I still had a very difficult time adjusting emotionally.
Yeah. Absolutely something that I see every single day. And I think you're absolutely right that you're probably not given the resources that many men aren't given the resources that they need right off the bat. I think it takes a lot of strength to reach out and to recognize what's going on and to ask for help. Men classically have been taught that they need to be stoic and
Mhm,
and men sort of hold things in and hold these emotions in. And oh, you're back in the gym a month and a half after your surgery, you must be fine. And that's not the entire picture, of course. There's so much under the surface of having a big surgery or a radiation that it's changing sexual function. It
mhm,
changes penile anatomy, loss of penile length, and it can change abdominal anatomy. You have scars now. It can change the relationship dynamic. Sometimes haven't had to have any procedures, luckily, in their life, and having a catheter in feels really maybe traumatizing.
mhm. It is.
Um, Leaking urine, obviously I see guys who've been in diapers for years after prostate cancer surgery, and it breaks my heart that they've never been made aware that there's something they can do, and they've been suffering silently for years.
Mhm,
And obviously, as a surgeon, I can luckily help some of this, but I can't really unwind that mental change that men have gone through. The mental change that comes along with prostate cancer diagnosis and treatment um, is huge.
mhm,
I'm just so grateful for, you making a podcast and spreading awareness that men are not alone and that it's, very much a part of the journey of a prostate cancer patient to have some mental health changes and that there are resources that men can seek. You and, others that like the Zero Prostate Cancer Group, I feel so fortunate that those things exist. And I just hope to raise awareness because without being able to see it, you don't know
mhm,
that there is help and that there are so many guys going through
mhm.
it alongside you, and having that community is really, really helpful